Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders past, present, and emerging. Hello, everyone, and welcome to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. We are champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week, we bring you scientific and practical insights on each element with the expert knowledge of professionals in the field. I'm your host, Marie Stella, coming to your ears from Naarm, Melbourne, Australia. Let's learn together. Hello and welcome back to the show. For centuries, the pursuit of longevity has been dominated by conversations surrounding diet, exercise, genetics, and medical innovation. And of course, all of these are vital factors contributing to longevity. But there is a domain that is often neglected, and that's our mental well-being. Even just this morning, I was having a conversation with a colleague about how longevity is not just about physical health, and it's about mental health as well. So in this episode, we are taking a look at the mental health system and why it needs reform for better longevity. And to guide us through this is medicine and psychiatry professor Robert C. Smith, who is based at Michigan State University. With many publications and awards, as well as strong grant support, Robert has been involved in teaching and research in patient-centered communication and primary care mental health since 1985. So welcome to the show, Robert. It's great to have you here.
Good to be here, Maria. Thanks for asking me.
Yeah, I'm really looking forward to learning more about this topic. But before that, tell us a bit about your background and what compelled you to pursue medicine and psychiatry.
Yeah, it's an interesting story. I went to a university, like all universities that train doctors. It was steeped in physical diseases and almost nothing in mental health and mental health care. And 4 years of that in residency and 4 years in medical school and 3 years in residency. That's 7 years. I heard almost nothing but physical disease. Now I get into practice and I'm finding all kinds of people I'm not prepared to take care of. People with mental health problems, people with emotional issues, and so on. And long story short, I found I was very inadequate in dealing with these people. And that led me over time to kind of re-evaluate myself and what I was doing. And I started listening better, listening to emotions and so on. But I still, even after 6 or 7 years, never got comfortable diagnosing and especially treating psychiatric disorders. And there were many of them, these frightening panic attacks that brought people into emergency rooms, depression, alcohol problems. I hadn't a clue of what to do with that kind of stuff. And at that point, I went back to the University of Rochester and took additional training in so-called biopsychosocial medicine, and that included lots of time on inpatient psychiatry and in doing psychotherapy. And I then went to Michigan State, and I've been there, as you say, since 1985, working to help primary care doctors do better at primary care mental health. And I'll turn it over to you there.
Well, that is so impressive to me, and it's such a valiant cause. So I'd love to know, what have you observed in your career that supports the need for mental health system reform to improve long-term health outcomes?
Oh my, there's so many aspects of that, but basically no more than 25% of the entire US population with mental health problems. And mental health is the most common health condition there is. It's more common than heart disease and cancer combined. There's over 90 million people, almost 100 million people with a major mental disorder. And yet only 25% of these people get any care at all. And most of that care is by untrained primary care doctors, like I was in practice. Now compare this. This is shocking. Only 25% of mental health patients are getting any care. 70 to 80% of people with physical disease problems do receive care, and that's quality care because those doctors are trained in physical diseases. And so that's probably the most condemning thing. I mean, and Thomas Insel, he's the former director of the National Institute of Mental Health, and who would know better than he, underscored the problem. He said modern mental health care is a human rights issue. It is so bad, and so little progress has been made.
Yeah, those are some pretty damning numbers. And yeah, I feel like even though mental health has definitely been rising in terms of how much discussion there is and how much discourse there is surrounding it in recent years, it's still by and large, a lot of people don't necessarily take mental health really seriously. So that's a great preface for our topic for today. But before we get further into detail, I would love to get to know you better. So this is Have You Met Robert? And my first question for you is, what is your favorite book?
Oh my, there's lots of them, but I would have to say the Iliad and the Odyssey have captivated me the most, and stuff I go back to periodically.
And what about movies? What have you enjoyed recently?
Oh, last time we watched one like Almodovar. I've seen many of his movies, and there's some very, very good ones. There's one just on death and dying the other day that my wife and I watched.
Yeah. And as for podcasts, are there any that you're listening to at the moment?
Podcast. I really have not gotten that involved in watching podcasts. I've been on lots of them, but haven't found time to actually watch most of them.
And what about role models? Is there anyone that you look up to either in your professional life or your personal life?
Oh, yeah. Well, I mean, my parents, of course, but beyond that was George Engel. He was the head of the program at the University of Rochester I went to. And he is probably one of the foremost physicians in the last century, probably one of the top three or four. History will judge him that way, I believe. He was not only a brilliant man, but a even greater teacher. He he always had time for you when you had a question. Busy as he was and important as he was, he always stopped and took time. He stopped with me and spent hours and hours teaching me. This is where I first became introduced to general system theory and the biopsychosocial model that he articulated in 1977. And so he was just a wonderful person. And even following my transit to Michigan State, he and I were in touch weekly, sometimes daily, just talking about problems and how to develop an interview. And we had good times. So he became a friend as well as a mentor.
Yeah, teachers really are very admirable. And my last question for you is, has there been a class or a course that you've taken that has stuck with you to this day?
Yeah, well, it would be stuff through Engel, but more broadly, when I was in practice, I was at loose ends. I had no idea really what to do. Even being a nice guy wasn't enough. And so I took a 2-year fellowship at the University of Rochester under Dr. Engel. And that was just eye opening to me. I learned things there that I had never knew anything about. How to interview a patient. When I went into practice, when I would talk to a patient, all I would do is ask questions. Where's the pain? Where does it hurt? What medicine are you taking for it? And so on. I never let the patient talk. There, I learned the essence of what's called patient-centered interviewing. And there's some intricate skills involved in it. And it means relinquishing some control to the patient. And that was difficult for me because I wanted to be in control. And so there were all those tensions in learning it. But long and short, I learned it was an eye-opening experience at Rochester, and I carried it with me, and it set my career, and I carried it with me through the rest of it.
Oh, that's really interesting. I feel like I probably have had to adopt the same kind of principles in terms of hosting podcasts and like centering the
Yeah.
guest, for example. So that's really interesting to me, and I find that pretty relevant. That resonates. In particular with me as well. So thank you very much for sharing all about yourself today,
Sure.
Robert. It's been such a pleasure. But now I think it will be a really good time to talk about why the mental health system needs reform. So for starters, tell us about how you define longevity.
Oh, that's a good question. In my opinion, it's not just number of years, it's quality of the years. Some people are old from a quality standpoint when they're 20 years old. Others are still young when they're 90 years old. And it's more what you do with life. It's how it's how long you have a happy life which meets the needs of you intrinsically, where you are deep down, what you really wanted to do but never did. Did you do it? Mark Twain asked the pithy question. He said, you'll be more unhappy 20 years from now with what you didn't do than what you did do. In fact, that was part of what was happening to me when I was in practice. I had more ideas about what I wanted to do in a new direction. And it was only with that that I became truly happy.
Yeah, that makes a lot of sense. Recently, in the last couple of years, both of my grandparents passed away, and
Oh, no.
just seeing the difference in longevity for both of them because they passed away at around the same age. But one of my grandmothers, she had stopped living vitally for about a decade now, hadn't been able to go out on her own, has been having dementia, essentially not really living life truly.
Yeah,
But my other grandmother, who passed away around the same time, she was living vitally up to the last 2 years.
yeah,
And that makes a lot of difference. It's a few years of that you're able to still go out and do things.
yeah.
So that really is just really pertinent. And as for mental health or mental illness, how would you define that?
Mental illness, that's also a good question. There's lots of debate about it. Um, it's generally defined by psychiatry, and within that, by the so-called Diagnostic and Statistical Manual of Mental Disorders, DSM, now in the 5th edition, and there's a revised edition to that. And they define different mental disorders in there. Bottom line in all of that, in my mind, is that when people are having psychological, social, physical, emotional issues that interfere with what they want to do in life, that starts to point to a problem. Um, Many people get anxious about something or they get depressed for a day or two, but it doesn't interfere with their lives. And it really comes down to how your life has been altered or is being altered to things that you can no longer do what you want. And that kind of is the bottom line. I mean, the common problems in medicine and in medical settings are depression, anxiety, and drug addiction. And DSM-5 has fairly clear definitions of these things, but it and they in fact include what I've just said. Is this interfering with your life in a major way?
Yeah. And I know you mentioned a little bit about the relationship between mental illnesses or mental health and longevity, but could you tell us more about that? What does the literature say? What evidence has there been?
Oh, there's great deal of evidence. I mean, chronic disease, chronic physical disease is, after mental disease, the most common health problem in the US today. 17% of these people, that's some 30 million people, have a co-occurring mental disorder like depression or addiction or anxiety. And so the two go together. The physical and the mental go together. And the mental part of that must be treated if the physical parts to get better. But medicine doesn't do that. Medicine just focuses on the physical part.
Yeah, I've seen a lot of discussion online as well about how, there's one camp of people when it comes to discussing physical health and exercising. There's one camp of people that says, just go out and exercise will do so much better for your mental health. And then there's another camp of people that goes like, but I'm struggling to even get out of bed. I like my mental health is not good. I can't bring myself to exercise. And it's a vicious circle, right?
It is. No, it is. And the more healthy lifestyles you can get, from nutrition to exercise to meditation to journaling, uh, the not smoking, not drinking, all kinds of things, maintaining a normal weight, exercising, the more healthy things you can do, the less you're apt to have both a mental health and physical disease problem.
Yeah. So, what are the biggest weaknesses in the current mental health system, especially regarding its ability to support long term health and longevity?
Oh boy. That's what my new book, As Medicine Lost Its Mind, is about. Basically, and your listeners and viewers will be scared by this, but here's the biggest weakness. Primary care doctors are providing 75% or more of all mental health care. The problem is they're not trained to do this. Medicine did not train them. And the downside of that is just devastating. There's something like 17,000 opioid overdose deaths per year. These are being prescribed by doctors who are not trained in the use of opioids and not trained in pain, for which opioids are prescribed. 48,000 suicides a year, half of which see their primary care doctor in the month before they commit suicide. But doctors are not trained in suicide. Many of these could be saved. And we're talking here in the tens of thousands, 48,000, 17,000. We'll now talk in terms of tens of millions. Remember, I said that there was almost 100 million people with a major mental disorder at any one time in the US. Well, when these diagnoses are not made and treatment given that's effective, we know effective treatments, but if it's not given, there's unnecessary divorce, unnecessary school failure, unnecessary job failure, addictions, homelessness, incarceration. But again, don't blame your doctor for this. They've not been trained. Talk to any one of them and they'll tell you, like they did to me the other day, Bob, there's no psychiatrist in my town. What am I supposed to do? Another one says, so there are a few psychiatrists, but it takes 10 months to get somebody in to see them. And these doctors are telling you what the problem is. Only 10% to 12% of all mental health patients are seen by psychiatry. There's another 10 to 15% seen by psychology. That's why the remainder, 75%, are seen by untrained primary care doctors. The old idea has never worked that psychiatry was going to take care of all US mental health problems and other doctors would focus on physical disease. That's never worked because there's never been enough of them. So the problem is simple to solve this. Train the doctors who provide the care. And yet medicine refuses to do this. Even though mental health is the most common health condition there is in the US, doctors through 4 years of medical school and 3 or 5 years of residency receive no more than 2% of total training time in mental health care. That's not enough. The rest of that is devoted to physical disease care and related things like statistics and research. And so that simply is not enough. And so you come up to this question mark is how could medicine be so short-sighted as to not train its graduates for the most common health condition they'll see in practice? Has medicine lost its mind? That's the origin of the title of my book, is that rhetorical question. Have they lost their mind to do something like this?
Yeah. And do you have any insight as to why they might be refusing to integrate more mental health
Yeah,
training?
that's the key question. And more seriously, and in a different vein, ask the same question. Has medicine lost its mind? The answer is yes. It lost its mind in the 16th and 17th century scientific revolution. Up until that time, this is from the time of Hippocrates in the 5th century BC, this is over 2 millennia. Up until the 16th century, doctors had always seen the mind and body going together. There was no question about it. They didn't separate the two. But come the 16th and 17th centuries, this is when science of all sorts, from physics and mathematics and medicine as well, was burgeoning. And the church had been all powerful through all of the millennia preceding this. But medicine and other sciences were starting to get some traction and wanting to get some action. And so at this point, the church relented in its control over medicine and said, okay, medicine, you can have the part of the body from the neck down. We keep the head. That's where the mind, the soul, and the spirit reside. That's ours. And this was supported mainly by philosophers. I'm sure you've heard of Descartes, Locke, Hobbes. All of these people provided the philosophical and intellectual basis for that, of separating mind issues from body issues. And what that did was leave medicine focusing then on the physical body from the neck down. And over the ensuing centuries, this got translated into clinical medicine, doctors focusing just on physical disease and mind issues left to the church. Now, medicine took over mind issues in the middle 1800s or so, and it's always been medicine's task since then, but they still have done nothing with it. Now, the mind-body split, this isolated focus on physical disease, proved to be highly effective. It is responsible for all the dramatic changes we saw in the last century. Over the course of the 1900s, life survival doubled from 40 years in 1900 to nearly 80 years by the end of the century. And this was due to penicillin, sulfa, ether, chloroform, all of these things early on started curing and controlling acute diseases. Polio vaccines, all of these vaccines and public health measures came along. Heart disease was being controlled, and all kinds of dramatic changes. We're now involved in genetics, and fMRI machines appear inside our body. So there have been dramatic changes, but it's all been focused on physical disease, Maria. And so the problem is then, successful as it was, that come the last 20, 25 years of the 1900s into today, mental health problems have become the most common health condition. And obviously, by excluding the mind, you can't take care of mental health problems. But another problem has come up. I mentioned earlier that chronic physical diseases are the most common physical condition today. Excluding psychological and social and mental problems hurts that also. And here just an example is, you've heard of all the chronic disease like diabetes, heart failure, stroke, lung cancer. These are almost all caused by psychological and social factors that medicine ignores and excludes. Cigarette smoking, alcohol use, not exercising, overweight, stress, and so on. These are all psychosocial factors that medicine ignores. Now, if you've got somebody with diabetes or heart attack or lung cancer, it makes sense to teach them and tell them to quit smoking, drinking, overeating, and whatever it might be. But doctors don't do that. Now, take that a step back 30 years in that person's life. Why not medicine address all these things in a preventive way so that people never start smoking, drinking, not exercising, getting overweight, so on? If you do that, then these diseases never occur. It's well known that 80% of all heart disease, strokes, and diabetes can be prevented if we did that. 40% of cancers can be prevented by addressing these psychosocial lifestyle factors, but medicine does not do that. Now, of course, doctors will say you shouldn't smoke or get more exercise, but that's not enough. It takes intensive training and special skills called motivational interviewing, which are difficult to teach and difficult to learn. And doctors simply don't get that. They lack the supervised training in those things. And so medicine just lets the disease happen, all the complications from it, and then treats it, whereas they could prevent it up front. Now, we've got a $5 trillion healthcare expenditures each year. We could save, remember I said 80% of these most common physical disease problems could be prevented. What would happen to healthcare expenditures if we did that? You could save $2 to $3 trillion a year. But medicine doesn't do this. It simply waits until the disease happens and then treats it.
Yeah, that actually reminds me of this. I guess this little debate with myself. I was having a little pondering session. I was having in my head at some point that I was thinking there's so many the doctors that always say like just quit smoking, or dentists who always say like don't smoke, don't vape, these are horrible. And like I do understand the sentiment of like they cannot like I guess ethically recommend ways to just maintain your health or set yourself up for success while smoking. But I was wondering, like, smokers or like emotional eaters, these groups of people, I probably fall somewhere in between. Like, I have unhealthy habits of my own, but the main thing here is that they have an unhealthy habit for a reason. Like if they wanted to stop it just like that, they would. Like, no one wants to be a smoker, no one wants to emotional eat. It's just a coping mechanism that unfortunately they are prone to. And I was wondering more of like, what do people not mention? Like, what would be good, what would be good baby steps to get out of that, rather than just saying like don't do this or don't do that. Why is that?
And that's what medicine doesn't teach. But in some of the work I've done and my hundreds and even thousands of colleagues and faculty interested in this, there are motivational interviewing skills that people can learn. You have to educate the patient. You have to hear what they think about it. People, by and large, don't want to quit smoking. They don't want to quit drinking. They don't want to quit eating, and probably don't want to do much exercise. And so this is why it doesn't do any good to say you should quit smoking, because it's counter to what the patient wants to do. You're advising them to do something they don't inherently want to do. And so there are skills. You have to educate the patient about it. For example, that you might die 10 years earlier. You're apt to get heart attacks and cancer if you keep smoking. Alternatively, if you quit smoking, these risks go away within a year or so. And so, but there are ways to do this. You have to establish a strong relationship with the patient to even get them to listen to this. You then have to follow them up. They may not want to quit smoking or lose weight or start exercising the first time you see them, but you see them again a couple of months later or 6 months later, and you keep working on it. Doctors are not taught to do this. And these are not easy skills to learn. It's called motivational interviewing. So you have to educate people. It takes oftentimes multiple visits. You have to get a commitment from them. You have to see what goals they want. I want to see my grandchild graduate or play ball, whatever it might be. You have to negotiate treatments for it. And so these are complex skills. And they can be taught and learned and are effective then when deployed on these psychosocially based lifestyle habits. And these are not mental illnesses at all. These are simply psychosocial factors that medicine also excludes.
Yeah, and like you said, it is they are complex skills to achieve. So, what do you imagine would be some common struggles that prospective doctors would face if we were to implement a more preventative model, a more like mental health first kind of model?
Yeah, the biggest impediment they have is they're not taught what to do. They don't know any better than to say you should quit smoking or try to lose weight. Maybe you could lose 10 pounds by the next time I see you next year. And that doesn't work. Just telling somebody to do that, nice as you may do it, doesn't work. You have to establish a relationship over multiple visits oftentimes to be effective with this. And there are medications that doctors aren't trained in that also help with some of these problems. But these current anti-obesity medications, which cost something like $1,300 a month, that's not enough. You need to talk to the patient so they understand, so they want to lose weight. So it's with them. And so that you and they are working in conjunction. You're in a strong relationship with them to get them and work with them to lose weight and to be understanding when they don't, or if they don't want to, if they decide they don't want to. So there are no magic bullets to this. And there's too often people think, well, there's some medication we're going to take and I'll stop smoking. They don't work. They help, but they're not the bottom line. And it's more deep than that. And it's what you said. People, you are advising people to do things they don't want to do. And that does not work when you simply tell them to do that. It often alienates them, in fact.
Yeah, especially with the fact that most of these coping mechanisms stem from some form of discomfort or trauma in the past, and they're really hard to untangle just by hearing "just quit."
Yeah.
Just stop doing that.
Well, it makes it sound simple to do. It makes it sound easy.
Oh yeah.
Why don't you just quit? Yeah. Okay.
Yeah.
I can't.
Yeah. Okay. I'll just start tomorrow.
Yeah. I'll just stop. People are addicted to nicotine. They're addicted to alcohol. You can't just stop it.
And
I was
yeah,
once, I once smoked. This is years and years ago. And believe me, it's the hardest thing I ever did was to quit.
yeah. And on the other hand, though, what are some of the merits of the current mental health system? What do you think should be retained?
In the mental health system, uh,
Yes.
psychiatry and psychology are welcome, useful aspects of it, but they are too low in numbers. They should be increased. Psychology, by and large, lies outside medical system administratively. They're in a different ballpark altogether. They need to be brought in and integrated into medicine, at least those psychologists that want to. And there are ways to do that. But even if you quadrupled the number of psychiatrists and psychologists, it's not going to solve the problem because there will never be enough of them. Plus, patients don't go to psychiatrists and psychologists off the street, they go to their primary care doctor. And their primary care doctor has to learn to recognize that there is a problem that needs to be referred to psychiatrist or psychologist. And so the main problem now is educating physicians during medical school and residency in primary care mental health. And the problem then is getting medicine to do this. And medicine is resisting. And this is what the public needs to know. It's real obvious what needs to happen. Train the doctors who provide the care. Medicine won't do it. And this is why I've written this book, Has Medicine Lost Its Mind? Is to anger the public. The public needs to get angry about this. The public right now assumes its mental health care is as good as its physical disease care because they assume they don't separate the mind and the body. They just assume I go to the doctor, they know about all of this. Well, they don't. And the mental health care is suffering greatly. And people need to know that and to know that medicine is doing nothing about it. Medical education in psychiatry and mental health has not changed in over 100 years. And so something has to happen. The public has to hear this and become angry and get their politicians to do something about this, which comes from the top down. Medicine is not going to change. People have been telling them what I'm talking about here since the 1970s. They haven't done anything, and they're not going to. They're too imbued with this mind-body split. And so it's going to have to come from the top down. And what needs to happen there, how do you do that? How do you inflame the public? We have some examples. Now, this is before your time, probably, but Ralph Nader wrote a book called Unsafe at Any Speed. At that time, automobile industries had seat belts. They tested them. They knew they worked, but they didn't use them because they were afraid people wouldn't buy the cars and would cost them too much money. Nader's book came out and showed that exactly what was going on, that they were withholding safety measures for cost reasons. This book inflamed the public. They became irate, demanded, and their politicians then demanded change, which led to the Traffic Motor and Safety Act, which is why you have seatbelts in your car today in the US. Another example, Rachel Carson wrote Silent Spring. The chemical industry at that time was polluting everything it touched, did nothing about it. There was DDT in the water, they knew it, but it would have cost too much to correct it. Carson's book came out and blew the whistle, just like Nader blew the whistle on the auto industry. She blew the whistle on the chemical industry. That led politicians to then form the Environmental Protection Agency, which is why we have all the protections we do today, and in particular, we're not having DDT in our water. My book, Has Medicine Lost Its Mind, seeks to do the same thing. It's to blow the whistle on the medical profession activate the public and get them to get their politicians to do something about it from the top down.
Yeah, that is such a valid cause and is so important to us. I think now would be a perfect time to talk about the more practical aspects of this and talk about what our listeners can do to set themselves up for success in mental health and longevity. So, the first thing I want to ask is actually, what can listeners do right now, present day, pre-reform, because we're not in the post-reform like world at the moment. We are This is what the situation is, this is what we have to deal with. So what can listeners do? What kind of questions can they ask their general practitioner or their primary care
Sure.
practitioner? Yeah.
Sure. Somebody that thinks they have a mental health problem, and they feel
Yeah.
depressed. They're anxious all
Yeah.
the time, and it's interfering with their life. It's interfering with their relationship with their spouse, with their kids, their job, whatever it might be. That something is just not going right. They should go to their doctor, to their primary care doctor, and be upfront about it. Doctors are often busy, they're in a hurry. And people are afraid to talk to them and say, and so the doctor comes in and says, how's your backache and so on, and what medicine you're taking, and da, da, da. Be upfront and say, doctor, I want to talk about this. I feel like I'm depressed, or I feel like I'm drinking too much, or I'm feeling anxious all the time. I can't sleep at night. Whatever the problem be, I would like to get help for this. I would like you to refer me to a psychiatrist or a psychologist. And often it's best to first go to a psychologist. They are very good. They do good psychotherapy. They don't use medications, but psychotherapy works as well as medications for most of these things. And get a referral there. They often can determine then if the patient needs medications, which the primary could write, or they could refer to a psychiatrist. And so the critical thing is, if you think you have something, be upfront and force the doctor pressure. Now, doctors actually like this when patients are assertive and say what they want to cover and address. Doctors actually like that. It helps them to organize the visit. So don't be afraid of them. It's your life and your symptoms, not theirs. And so you're in there to be taken care of and make sure that gets done. Now, the other things in general, I think we talked about these, but I think find powerful is exercise. And, people vary in how much they can do. If you haven't been doing any, slowly get started out walking, walk a little more each day, and so on. But in the exercise, regular, every day, you should be doing exercise. The healthy lifestyle habits, not smoking, drinking, eating too much. It also helps doing things like some people used to call these diaries, but it's what commonly now called journaling, where you write about what's going on in your life, particularly what emotions are being elicited and what that emotion is making you do. And it helps to say some positive emotion that you had during the day, write about it and what you did as a result. Then a negative emotion you had during the day and what you did as a result. She looked at me kind of funny and then walked off. I was anxious and angry. I wouldn't talk to her the rest of the day. That's the emotion she had and what it led her to do. And pretty soon you start recognizing these things about yourself, and do I want to respond that way? But it's very helpful. Journaling has been very helpful. Friends, this is the day and age of loneliness, especially since COVID, and in my opinion, especially since cell phones. You'll see a group of people out for dinner, and every one of them's on a cell phone. They don't even know the other person's there. And This is very isolating. These are not healthy relationships you develop on the cell phone. You have to establish relationships, and it is critical. That's what we are. We are not individuals existing out in this world. We are our relationships. And so this is another thing that people do. And if you think you've got a mental disorder, it's also helpful to talk to a friend and let them know about it. Share it. And somebody, they don't have to fix it for you, but somebody that just listens and they're there with you.
Yeah. Well, thank you so much for sharing that. It's been such an enlightening conversation, and I have had such a good time talking to you about this. Now, let's move on to the open mic segment, and this is where you'll get the opportunity to talk about anything you're passionate about. So it doesn't have to be related to the topic, but if you wanted to, it can be. So the floor is all yours, Robert.
Oh,
Take it
sure.
away.
Sure. Well, I'm passionate about it. I think you've heard it already about transforming mental health care through better education of the primary care doctors who conduct most of it. Here's my book. I think, is that right side up? I think it is. That's my book.
Beautiful.
Has medicine lost its mind? And the idea in that is to inflame the public. This is a book for the public. This is not for doctors, and it's not for teachers or psychiatrists. It's for the public, because the public is the one that's going to get something done. And what I'm urging the public to do through their politicians is to get an investigation from an independent federal board, an investigation of modern medical education, to see how well they are treating the most common health condition their graduates face, which is mental health problems, and how well they're treating chronic physical disease problems. And you know what we're going to find. But they're going to be charged with looking at a second thing. How scientific is modern medicine? And what they will find is that only medicine among all the sciences, from anthropology to physics to biology, only medicine has not adopted the modern systems view of science. And basically, a systems view means you look at all parts of the problem, all parts of it, not just one part of it. Medicine is the only science that still, in its what's called reductionistic way, looks at just one part of the science. Now, what is the science of medicine? It's you and me as human beings, our social life, our environment, and our physical life, our heart, our lungs, and everything. Medicine just focuses on one part of that, just the physical part, and it ignores the person and their social, environmental life. And so that is non-scientific in terms of modern scientific principles. Medicine has conceptually failed to advance like other medical science, like other non-medical sciences have, to adopt a systems view of its science. And so this is what we want to happen. Now, I think you've got my website, but it's robertcsmithmd.com. And I want people to go to this because there's a place each individual can act with this. But remember to put the MD on it. Smith is too common a name. You'll never find me if you don't put MD on it. So it's robertcsmithmd.com. Go to the first page. What comes up, there will be a box on it that says Act Now. Click on it. There's a sample letter you can send to, and the email addresses are there for the President, the Surgeon General, the National Academy of Medicine, your congressperson, and your senator. Plug that into the email and send it. But also, if you've had mental health issues yourself or in your family, put your own little paragraph in there too about why it's personally important to you. This is the way each and every member of the public can get active and enforce and induce change. And so this is what this is all about. It's a movement, and it's a heartfelt one on my part.
Wow, that's amazing. You've really pulled out all the stops to make it easy for the public to get riled up about this. Now, if our listeners want to find out more about you and what you do apart from your website, where can they go?
My website will connect you to Facebook, LinkedIn, X, formerly Twitter. I'm on all of these. It will connect you to my 2 textbooks. One is patient-centered interviewing. This is used throughout the country and abroad as well for teaching doctors interviewing and how to establish a doctor-patient relationship. I've written also a primary care psychiatry textbook. All of these are in there. That tells exactly what doctors need to do. But the main thing now is this website will take you to Has Medicine Lost Its Mind? Here it is again. It will take you to that and point to the places you can get that.
Excellent. We'll leave those in the show notes. Thank you, Robert, for joining us today and for your very clear instructions on what to do when visiting your website. And to everyone listening, we hope that you learned something about mental health and how it's related to longevity and how the system drastically needs reform. Thank you, everyone, for tuning in. And Robert, do you have any last pieces of advice or any general takeaways to leave our listeners with?
Yeah, be hopeful. There is light at the end of the tunnel, and there are things you can do. It's not enough to complain about a problem. We all have to pitch in and do something, and this is the chance to do something. There is a movement afoot that's going to get this problem resolved. So Keep the faith.
Yeah, exactly. Well, thank you everyone for tuning in, and we'll catch you in the next episode.
You have been listening to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. More episodes are available from 10 life management perspectives and can be found by searching LMSL on Apple Podcasts, Google Podcasts, Spotify, YouTube, and other podcasting apps available on your devices. If you enjoyed this episode, please rate, share, and subscribe to our channel so that other people can find it and we can continue to provide quality content. More of our work can be found on our website at longevity.lifemanagementsciencelabs.com, where you can join our movement. I'm Marie Stella. Thanks for tuning in.